Hey there, and good afternoon, everyone. I am Lauren Sisler, sports reporter for ESPN and AL.com here in Birmingham, and also a board member and volunteer for the Addiction Prevention Coalition. I am joined today by Dr. Stephen Taylor, who is also on the board of directors with me at the Addiction Prevention Coalition. Dr. Taylor has an incredible resume. I'm going to kind of go down the list here. Dr. Taylor, a general and child, adolescent, and addiction psychiatrist. As a medical director, he also works closely with the NBA and the National Basketball Players Association Player Assistance Anti-Drug Program. And today we are going to talk prevention. We've been looking forward to this topic for quite some time. And Dr. Taylor, first off, thank you so much for joining us today to talk about this very important topic.
And thank you so much for having me today, Lauren. I'm really excited to talk about this.
So first, I've got to ask you, where are you coming to us from? Your backdrop looks a little unique.
This background is actually my alma mater. I went to Howard University College of Medicine for medical school. And what you see in the background is a picture of Howard University Hospital and the front walk right up to the front entrance of that hospital, where I spent the last 2 years of medical school getting my basic clinical training as a medical student.
I love it. Of course, I love these virtual backgrounds that you can put behind you and, you know, can take us to that special place that we have in our hearts, even if we aren't able to travel as much during these times. Before we do get started, I just wanted to remind everyone that we are going to be taking questions. So you can type out your questions in the chat form there at the bottom of the screen. You'll see the little bubble that says chat. You'll also see the Q&A bubble as well. So you can jump in there and share questions, and we can take those, and you can certainly remain anonymous with those questions. So feel free to send us those questions. So we hope to address those a little bit later in the hour. And so we're going to try to keep this within the hour. So we'll have you here from 3 o'clock to 4 o'clock Central Time if you're viewing us here locally. And let's just get this thing started by first shattering the image that many of us have regarding drug addicts. And Dr. Taylor, I've seen you speak at multiple events, and that's one thing that you do a great job of, is illustrating, you know, what a drug addict is perceived to be and shattering that image. So how do you break down some of these profiles that we've really created in our minds about what an addict looks like, how they act, who they hang out with, and the company that they carry?
So basically, I'll even go so far, Lauren, as to say that over the last many years, I have actually stopped even using the word addict, because that word in and of itself tends to be pejorative in a way. Now we have, so many of us have it ingrained in our language. Even people who are in recovery will often refer to themselves as addicts. So I'm not judging anyone, and people are free to use the term if they want. But in my own practice and in teaching everyone that I teach and in speaking to everyone that I work with, I don't use that term anymore, in part because it's misleading. The idea of an addict being something different from any other person in the world is misleading. The fact of the matter is, any individual person could conceivably suffer from the disease of addiction. And since addiction is a medical disease, substance use disorders are medical illnesses that are treatable and controllable, although not necessarily curable, then we have to understand that anybody could conceivably be suffering with this. And therefore, we don't want to refer to people who have this illness as an addict. We refer to people who have the illness of addiction as a person with an illness. Okay, a person with an addiction disorder, a person with a cocaine addiction or an opioid use disorder or what have you. That's the way we try to do it, because that reminds us that that could be anybody, and it absolutely could be anybody. I once worked with a gentleman in a hospital who was in recovery for many more years than I had been alive, frankly. And he said, you know, if you shake any family tree, there are bound to be a few people with addictions who fall down to the ground from that tree. All right. And the point is that we all know somebody or have someone close to us. It could be a mother, a father, a sister, a brother, a child of ours, a cousin, somebody who has been touched by this disease of addiction. In some cases, we don't even know who they are. And so it's really important to remember anybody could suffer with this illness, and therefore, you know, the person with an addiction can be wearing a business suit. They could be a member of Congress. They could be a police officer. Frankly, there could be a physician. There are physicians help organizations, physicians health organizations all the time who treat physicians and attorneys and other medical professionals and legal professionals who have the disease of addiction. Anyone can suffer from this illness.
And I think it's a great point you make, because I do think that we do have these perceptions and these thoughts about what exactly it looks like. And you set that profile. And to your point, we are all people. And I think that it is treated as such, just like any disorder or disease, that we are all people and we're all suffering and battling through that, whether it is the individual themselves, like you said, your next door neighbor, a loved one, someone you go to church with, someone that checks you out at the grocery store. You just never know. And I think that's so great to humanize this thing, because I think that's where the stigma comes in, that we are not able to humanize this disease, that it becomes a stigmatized disease and disorder, and oftentimes not even recognized as a disease. And that, I think, deters people oftentimes to get the help that they need. And so I think we'll get into that here in a few minutes about some of the signs, obviously the prevention aspects of that. I want to take it just another step further and address the drug dealers, because I think that's another facet of this, because I think a lot of times people don't, when you think of a drug dealer, you just assume it's someone on the streets that's pushing drugs and they're going to have a certain look about them or a certain way of doing business, but it's not always the same. And so I think that's another thing that we need to profile and highlight in ways to be aware of this, so that we could perhaps prevent ourselves or loved ones from going down that path on what a drug dealer might conceivably be one of us.
Well, if you take a good look at me and you look at the background of Howard University Hospital, I always make the point that we are still in the throes of this opioid epidemic, the so-called opioid epidemic, which is really an addiction epidemic. But in that epidemic, a lot of the people who were the drug dealers look like me, right? They look like any physician. They look like some of us who may be wearing white coats and scrubs, because a lot of people who in many cases unwittingly and unintentionally contributed to the development of the opioid use epidemic and opioid overdose epidemic were doctors who prescribed people opioid analgesic medications with the intention to try to relieve pain, with the intention to just make sure that people did not suffer needlessly from pain. And so we prescribed, and in many cases prescribed too frequently and too readily and too aggressively opioid medications to people who probably shouldn't have been maintained on opioids for as long as they were. And a certain percentage of those people did go on to develop addiction problems with those opioids. And so who's the drug dealer there? The drug dealer was a respectful, highly educated person doing their best to try to help somebody who actually prescribed you a potentially dangerous, addictive drug that can kill you in overdose. You see, so the whole stereotype of the drug dealer, of being this unscrupulous, evil person that's just out to make a whole bunch of money at the expense of some poor person who could end up destroying their lives and then losing their lives, that's a stereotype. And there certainly is a subset of people who are quote unquote drug dealers who fit that stereotype, but there are many other people who are involved in dispensing drugs and medications that could potentially be addictive and dangerous. And it's really not a good idea to just generalize and stereotype too much.
Now, of course, we're in the midst of this pandemic right now. We've seen a substantial uptick in drug use, drug abuse, and mental health disorders as a whole during this time of uncertainty and isolation. And that's one of the biggest things we talk about, is not wanting to isolate, to surround yourself by a strong community of people to help you in combating these substance use disorders and obviously mental health illnesses and things like that. What are some trends that you are seeing currently and working on eradicating during this time and this very uncertain time that we're all kind of trying to figure out right now?
Well, Lauren, addiction is a disease of isolation. Many people have made that observation. You want to continue to use the drug that you use or drink or whatever it is that feeds your addiction. Generally speaking, you try to push people away. You try to stay away from other folks. You don't reach out for help. You try to internalize and turn internally and isolate and use. And that, so it really is a disease of isolation. Therefore, the way we have traditionally helped people to get into recovery and remain in recovery is by having them reach out to other people. That's what 12-step meetings are all about, and mutual help meetings. That's what treatment programs are all about. So often in engaging people in group treatments where they're interacting with other people and they are sharing of themselves and being honest with themselves and about the struggles that they're going through. And that in and of itself becomes very helpful therapeutically. So now here we are in this pandemic in which we don't have the ability as often to reach out and be around other people and spend time with other people. And that's had a devastating effect, quite frankly, nationwide on people with substance use disorders. Many treatment programs have had to go virtual. And there are 12-step meetings, many of them, that have had to switch to using formats like the one we're using, video conferencing formats. Many intensive outpatient treatment programs have switched to doing things instead of having people go to a particular center and sit around in a circle with each other in person, being able to shake each other's hands, give each other a hug, congratulations on the fact that you've not been able to use for this last week or these last couple of days. Well, that's all changed. And now a lot of times virtual meetings of the type we're having now are the only kinds of meetings that a lot of intensive outpatient programs will offer. And for some folks, that is very difficult, and it is a loss. And so we've seen increased rates of people struggling with addiction. We have seen an increase in opioid overdoses, frankly, during this period of time during COVID-19. And we've seen many more people that have had just a very hard time getting the help they need when they have needed help, because the programs have closed down. A lot of the staff members are not there as available readily because they themselves are trying to protect themselves and their families from getting sick. It has been a major challenge for those of us who take care of folks with substance use disorders.
So would you say during this time, obviously, as we get into some of the signs and symptoms and preventative measures, that the uptick that we're seeing is a product of this isolation? And, do you think that's a big catalyst for why people are experiencing maybe more relapses during this period of time that we've been in self-isolation?
That's one major part of it. But the other part of it is, look, anytime you read the statistics or watch TV and you see the statistics of 160,000 people of our fellow country people who have died in this pandemic, that is devastating. That makes you sad. That also makes you anxious because you worry about the possibility that you or someone you love or someone you know could join those statistics. The idea that we have, millions of people who have been infected with this coronavirus, that's anxiety provoking. Well, guess what? Most unfortunately, one of the most common reasons for someone with an addiction disorder to suffer a relapse is if they have a spike in anxiety or if they go through an episode of depression. And it's a very depressing time that we're in with so many people that are getting sick and are dying. And the remedy, supposedly the way to deal with this, which is not supposedly, it is the right way to deal with it, is for people to stay away from each other and to isolate and be at home, which, as I said before, goes against what we generally want to do in terms of therapy for addiction use disorders. So it's a really tough time. We've got this pandemic that is depressing and is anxiety provoking, increasing the risk that someone with a substance use disorder might relapse and might have a hard time. And then the treatment that we know works and that we recommend for people to get isn't available to people as it would normally be, and if so, not in the same format. And so it's a very difficult time. It's a combination of factors that make our job of keeping people with this illness well, makes it a lot harder.
Obviously, great points that you make there, and just the emotional aspect of all of this, and really just not having a manual or blueprint for how we're supposed to navigate this time. And so I think that uncertainty just, is again a catalyst for, this disease, and obviously this illness that we, are seeing an uptick in now. As we mentioned earlier, addiction doesn't discriminate. It impacts all walks of life. And I say this time and time again, it does not matter the job that you hold, the car that you drive, what that paycheck looks like every week, the neighborhood that you grew up in. There are factors that go into addiction, but it does not discriminate. And nobody is invincible from this disease. Nobody can, walk through this life and say, you know what, like, this isn't me. There's no way, no how this is happening to me. And so I just want to ask you, from the early stages of addiction, what are some signs and symptoms that might indicate that a person is experiencing substance use disorder and that they may need to go seek help?
Well, let's start basically with the understanding that addiction is an illness that generally starts in adolescence. Okay, and so we need to be looking at what's happening with our young people. If you want to have an understanding of what are some of the warning signs, what are some of the things you see in some of our young people, some of our adolescents? Well, one of the things that you would expect, and that is the case, is a decline in school performance, or a change in the friends, the people with whom they hang out, the people with whom they feel comfortable. Many young people who are starting to get into a substance use problem, all of a sudden what you notice is gradually, and sometimes not so gradually, there's a change in who they find interesting and who they find intriguing and who they find are the people that they want to hang out with and want to emulate. Now, obviously, naturally in adolescence, your parents become less and less of the people that you want to idealize and listen to and think that they know everything about the world. And your friends become the people who know everything and the people that you want to emulate. That's normal. That's normal development in adolescence. But when those friends switch from being the ones who are, serious about school and are interested in extracurriculars and want to pursue something and make something of themselves in a good career, and they tend to be the people now who want to hang out after school and not get involved in extracurriculars and just sort of drink and get high, and who have disdain for the preps who want to just do pro-social kinds of things. Well, then at that point, when you see that kind of a change, that's a warning sign. Another warning sign is, of course, having more conflicts with parents, with family members. So you'll see more family arguments. You'll see the teenager being less interested, less willing to engage in family activities, and to less willing to be with family members over dinner, for example, and wanting to rush into the house and then run right up to their room and isolate in their room. Again, disease of isolation, like I said. So that can be a warning sign. Changes in mood, irritability, being much more argumentative, being much more willing to buck the rules and go against the rules. So those would be signs. In an adult, you can see the signs, the warning signs of an addiction problem in some similar ways, but in an adult context. So, adults that will be more irritable, more argumentative with their loved ones, spouses that have more conflicts and arguments. Maybe an adult who's much more quick to yell at their children when it isn't necessarily a situation that would call for that. Maybe more absenteeism from work because they have to sleep off a rough night of drinking, for example, would be the kind of thing that you might see. In adults, more so than with adolescents, you might see medical consequences of substance use. So those are some of the warning signs that you might see.
All great points there. And, just to kind of articulate a little bit on that from my own personal experience. And, again, hindsight's always 20/20. For those of you who don't know my personal story, both of my parents passed away from prescription drug overdoses back when I was a freshman in college. And some of the things looking back on, I now see. At the time, I wasn't educated. I didn't understand addiction. I didn't understand it at all. And, both of my parents were going to a pain management doctor. They were trying to use their medication to help them cope with some of the chronic pain. And, you know, looking back, you talk about the irritability, you know, some of the arguments that my parents would get in kind of came out of nowhere. And it was something I wasn't accustomed to. I wasn't used to seeing it. And then, you know, I just remember my dad falling asleep very quickly. You know, he could never make it more than 10 minutes into a movie. And next thing you know, he's on the couch, remote's up in the air, and he's asleep. And, you know, I just thought, okay, dad's probably just tired. He commutes over an hour each way to work every day. It's been a long week at work. And, you know, the absenteeism, that's another part of it. And then, of course, finances. I think that was another area that was kind of blind to me as a young teenager, that I didn't understand that the finances were in a bit of turmoil. And, you know, my parents were really struggling to be able to pay the bills and to be able to afford everything, you know, because of some of the money and where some of the funds were being spent in order to, you know, kind of medicate and obviously help them to function and be, you know, a functioning member of society the best way that they could through that pain. As we further that, you know, you talk about adolescents and you talk about adults. What about the young athletic community? I think that's another area that's very interesting to me. And, you know, especially right now, the athletes are kind of at the forefront right now of this pandemic, because we're all sitting here trying to figure out, you know, is there going to be a football season? If I had $1 for everyone that asked me that question as a sports reporter, is there going to be a football season? I can tell you, I do not have the answer to that. But as of right now, we do know that, you know, a handful of the leagues have made that decision. You know, on the college level, obviously high schools are trying to go back to work. We've seen some schools that have just gone back to school, right? Some school districts, and, you know, teams are practicing and they're anticipating playing. But that kind of leads us to that question about our young athletes. You know, you talk about it starts with adolescence. How are athletes at risk for substance use disorder?
You know, athletes are at very high risk in a way, specifically for opioid use disorder, more so than others. And I'll highlight that one. And there's also an increased risk for certain other, like alcohol use disorder as well, which frankly is much more prevalent than opioid use disorder. But I want to focus on opioids for a second, because we're in that epidemic of overdoses and deaths and addiction to opioids. Athletes, by virtue of what they do, will suffer from injuries, okay? Athletes get injuries. That's part of what happens. And those injuries are painful, acutely painful. And guess what? The most effective medications we doctors can prescribe to help somebody with acute pain, guess what those medicines are? Opioids, okay? Also, athletes will suffer injuries that will require surgical procedures. And that's what we doctors use to provide post-operative pain relief after surgical procedures. We use opioid medications. So athletes are at increased risk because of those factors for being prescribed opioids. And of course, if you're at increased risk for being prescribed opioids, then you automatically are increased risk for potentially developing a problem with opioids. And so that's the challenge with athletes. What I would say with young athletes who are still, you know, in high school, at home with their parents, and their parents are able to take care of them, I always talk about the parents' role in taking the lead and making sure that they take some measures that can prevent their young person from developing a problem with opioids. And part of it has to do with the parent recognizing that just because some doctor wants to prescribe your youngster an opioid medication, that doesn't necessarily mean that that's what your youngster needs. So parents need to be willing to ask the doctor, wait a minute, let's be clear. Does my youngster really need to be on oxycodone or hydrocodone for pain relief after this procedure that you've performed on her? Does she really need to be on that medicine? And if so, for how long does she need to be on it? Maybe she may need oxycodone or hydrocodone or some opioid level pain relief, but perhaps it's only going to be at that level where it needs that level of pain relief for 2 days or 3 days. So if that's the case, please, doctor, do not prescribe my child 30 days worth of opioid medication for a pain problem that's only going to be severe enough to require opioids for 2 or 3 days. Okay. And then, of course, once the doctor prescribes that medicine, guess who needs to be the person who controls the medicine? The parent, not the young person. okay? Because the parent needs to be in charge of making sure that that young person only takes that medication when they absolutely need it, that they take as little as is necessary, and that as soon as it's not necessary anymore to treat opioid level pain, then that person, that medicine should be discontinued, and the person should be converted to a less potentially addictive, less potentially dangerous kind of pain relief treatment, such as a non-steroidal anti-inflammatory medicine like ibuprofen or something like that. And so that is what, those are some of the factors. And then of course the big one is, you know, if there are leftover medications after a pain medicine has been prescribed and has been taken, and the person no longer needs opioid level pain relief, take that excess medication, that extra leftover medication, and get rid of it. Do not keep it around in the medicine cabinet where that young person can get access to it, maybe share it with their friends, sell it to their friends, or what have you. Those are some basic measures that can literally prevent a lot of the problem with the prescription opioid use, which we know was the starting point for many people to go on to develop more other kinds of opioid use, including heroin and the synthetic fentanyl and other synthetic opioids. So those are some basic measures. The other thing with athletes, again, is recognizing this culture of binge drinking, which occurs a lot starting in high school, but also continues among college athletes. The idea that and parents can have a lot to say about that. The idea that parents don't need to encourage athletes or any adolescents for that matter to drink alcohol as a social measure if they're actually not of legal age to drink. And the fact of the matter is how parents treat alcohol and how they regard alcohol and how they talk about alcohol and the rules they set and expectations they set in their home goes a long way, and the research tells us, towards helping shape the way adolescents view alcohol and the way they approach using it. And so that's another serious prevention measure that parents can take. Don't have a party in your home and think that because they're in my basement and I've taken all their car keys and so I can observe them and watch whether or not they're drinking and how much they're drinking, then it's okay and it's safe for me to allow them to drink. That actually has been shown to increase the likelihood of adolescents getting involved with alcohol, not decrease it. That's been shown by research, and those studies have been replicated, and the same findings have come to the fore every single time. So those are some basic measures just regarding those two specific substances that we know are particular risks for athletes.
Yeah, and I think you make a good point. And really what I'm hearing is that it's just as important for the parents to become educated and equipped as it is their children, right? And I think that's where, you know, we really have to kind of stand in the gap and be able to have these conversations that we're having now to remind people that it is also the parents' responsibility to implement this, as well as getting that information to their kids. So we can educate all day long, but it's channeling it into the right, the right resources, the right people. And one thing to kind of follow up on that, when you talk about prescription drugs specifically, one statistic is that about 1/4 of every adolescent that becomes addicted to, prescription drugs, it usually starts with an injury, an athletic injury, most likely, and or a dental procedure. So wisdom teeth, as adolescents, that's, I remember in college, I think that was when I ended up getting my wisdom teeth out. And, I'm one of those that actually gets sick on opiates. I mean, it just destroys me. And I'm like, maybe that's a blessing. I don't know, but I'd be interested in getting your perspective on that, because, if a child is prescribed a drug, would it be, is it possible to really know that how the child's reaction is to it? And, there's some people that get sick. There's some people that it doesn't really affect them. And then there's some people that have that euphoria that has them craving and wanting more, even after just one pill. And so how, is there like a measure or a system that you can kind of use to gauge that and say, okay, we need to be extra cautious with this because of the reaction my child may have had to this medication.
Interesting that you say that. The number one risk factor for a young person to develop an addiction problem is to have a parent or who has or has had an addiction problem, or to have a strong family history. That's the number one risk factor. So, you know, and it's interesting, you've shared with us so graciously your own story and the story with your parents. Well, the fact of the matter is that would suggest that you would be at particularly high risk, right, for developing a problem with addiction, and particularly with opioids. And yet, ironically, you point out the fact that, you know, when you take them, they make you sick. I will tell you, yes, that is a blessing. That is a good thing. I also happen to be in that category. I've had occasions where I had to take a prescription opioid, and it also made me nauseous, and I hated the way it felt. So I have, and there's a subset of us. We represent a group of people, a subset of the population for whom that's the experience. But I've also had the experience working in this field of taking care of people with addictions, of working with folks who've explained to me that that was their experience the first couple of times that they actually got nauseous and got sick when they took opioids. But because they knew that they could eventually get a buzz or a euphoric experience from it, they kept taking it and they kept trying it. And eventually they overcame that, and it did become pleasurable, and they did in fact end up becoming addicted to it. So even that isn't an absolute barrier that protects you. So that's one thing to keep in mind. The other thing to understand is, yes, there will be that person. And I have personally taken care of young people. One 15-year-old girl I'll never forget talked about going on a mission trip with her father to a Latin American country where they had much more liberal drinking laws and everything. And every night at dinner, after they would work really hard doing this great missionary work in this rural poor community, they would all sit around at dinner and they would all have wine with dinner. And this 15-year-old explained to me what it was like the first time when she was 11 and her father let her taste some of his alcohol. And she told me, she said, I took that and it went down. And the first thing that came to my mind was, oh my God, I so want to feel like this the rest of my life. Wow. And so by the time that girl was under my care at age 15, she already met full-blown criteria for an alcohol use disorder. She already had alcoholism at that point. So there is that does happen with some people, and it is something to watch out for. But more often than not, it's a more cumulative kind of effect where, you know, continued exposure, continued use develops into a pattern of use that then can escalate over time to becoming a dependence pattern and a real addiction problem. The bottom line is the safest thing for parents to do is to have a zero tolerance policy. Remember, people forget this, but it's actually worth remembering. It's illegal for people under age 21 to drink in this country. And that drinking age was moved up to 21 for a reason, because of the safety statistics that we saw in 18 and 19 and 20-year-olds drinking and then getting on the roadways and having horrific motor vehicle accident rates and everything. And so it actually was President Ronald Reagan who was instrumental in raising that age to 21 for people throughout this country. People forget that. So the one thing that parents can do is just say, look, you know, the law says not till 21, so we're going to adhere to the law. You're not allowed to drink alcohol in my house until age 21. There are very few people who adhere to that. People consider that to be so extreme, and yet that's a very simple, very legitimate, very valid measure that parents can take that can limit their kids' risk of developing an alcohol problem. Because the statistics tell us that people who wait later before they start using alcohol actually have a much lower risk of developing an alcohol use disorder than folks who get started drinking when they are teenagers.
Yeah, and you know, one thing I want to point out as we get into some more of the preventative measures that can be taken, you know, as it pertains to opiates, and for me specifically, you know, when I've gone to speak to adolescents, student athletes, you know, specifically middle school and high school level, one question, or, you know, maybe one, you know, surprise that a lot of these kids are finding is sort of the progression that happens with drugs, you know, because you talk about different drugs being a gateway drug, right? And you know, with legalization of marijuana in various states and sort of how that, you know, transcends into other drug use. But more specifically, with opiates, I think that there's a shock factor when especially our young adolescents learn that the use of opiates can progressively lead down a road of injecting heroin or using street drugs that people would normally deem like untouchable. I would never touch that. There's no way in the world I would ever become a heroin addict. And so how are you able to break down some of those, you know, misunderstandings amongst people and kind of in our culture and saying, hey, like this is a real thing. And just because it's prescribed by a doctor does not mean that it's okay or will work for you specifically.
Right. Well, and part of that has to do with the understanding that anytime a doctor prescribes a medicine, any kind of medicine, even a medicine that's not addictive, there are potential adverse side effects that medicine may have. Mm-hmm. Okay. And all doctors, when we go through medical school and we learn to prescribe people medications, one of the things that we are made aware of is we always are mindful of yes, we're prescribing the medicine for a potential therapeutic benefit, but we're also aware that it may also have an adverse side effect. And we are supposed to discuss and explain those potential adverse side effects to our patients and make sure they understand them before we prescribe the medicine. When it comes to a potentially addictive drug, a potentially addictive medication, like an opioid, for example, and let's say you're an athlete and you're under my care and you've just had a fracture and I've just called in the orthopedist to fix your fracture, and now I know that you're going to have very significant pain for at least a couple of days. Well, one of the things that I need to be discussing with you is the fact that you need to take this only in the amount that I prescribe or less, and only for as long as you absolutely need it, but no more than 3 days maximum, okay? We need to be very clear about that because of the understanding that one of the potential side effects of these medications is potentially developing an addiction problem, potentially even overdosing if you take more of it than you are supposed to. If we doctors are careful enough doing our job in that regard, we can go a long way towards preventing young people from developing that issue. For the person with the problem who's taking the medication, you need to understand that any medicine you take can have potential adverse side effects and potential adverse consequences for you. And for the prescription opioid medicines, and frankly, even for stimulant medications that people take for ADHD, that's another category that can kill you in a totally different way and can be detrimental to you in a totally different way. But the same principle applies. If you take it in excess, if you take it more than it is prescribed, if you take it more than is necessary, you can really do yourself much, much more harm than good. And so that's really an understanding that we want people to have in general, that medicines, although they can be very helpful, can also be harmful if not taken exactly the way they're prescribed or less, and taken with an eye out for being very careful and taking only as much as is necessary for your problem. And if you find that you're needing more than the doctor has prescribed, or needing more and more over time, that's the time to pick up the phone and call your doctor, because that should be an alarm signal to you that, hey, maybe something's wrong here. This isn't a good thing, that I feel like I need to take more of this than I've been prescribed, or more of this than I feel is safe. That's the time to pick up the phone and make a phone call your doctor, get some help, because you don't want to go down that road.
Yeah, because like you said, prescription is a prescription, but the goal is to take no more than or even less than that's prescribed, because that's really just there to help you to get past that point, point of pain, and to help you be able to resume normal functionality as you're healing in that process. Now, I want to get to some questions, and these do pertain to prevention, because that's why we're here to talk about prevention. And a couple questions that have come in. So guys, we got about 20 minutes left or so. So please submit your questions if you've got any, based on the conversations that we've had thus far, anything that you want to know about. But I think this is a great question. How do you prevent something that you can't identify? And I think, we've hit on some of these points as it pertains to, the family history and various things like that. But, mental health in general in our brains and how we consume things and how we operate is somewhat of a mystery. And it's not out there for us to see and visibly be able to quite understand. So how do you prevent something that you can't always identify with? And, take us through some of those steps and some of those critical areas that can help us prevent the problem before it starts.
See, this is an area that I talk about a lot. You don't necessarily, obviously it's great to be able to recognize the onset of an addiction problem or the onset of a mental health problem, but many of the practices that parents can, and I talk about parents and adolescents a lot because, again, that's where addiction disorders start, and in many cases, a lot of mental health conditions start in adolescence. So many practices that parents engage in with their adolescents, with their teenagers, if they are doing them in a healthy, wholesome way, can go a long way towards preventing a problem, even if you're not aware of the fact that you're preventing a problem. So, for example, one of the things I always advise is, to the extent that's possible, having family dinners, okay, in which people actually sit down and have dinner together with their young people, to the extent possible. And not every family can do that, but to the extent that you can. Even if you're not able to sit down and have a family dinner, having a set standard of what is acceptable in your home, having set family standards and family rules that are strictly enforced by parents. And so that your youngster knows what your expectations are and knows that it's not going to be okay if they, for example, come home with red eyes from having smoked marijuana or drunk from having engaged in alcohol use. Having those kinds of standards can be very helpful, can go a long, long way. And then, of course, having an open dialogue with your youngsters so that they can come to you and talk with you about things and you can share wisdom with them, that goes a long, long way. And so even though you don't necessarily know that by doing those things, the research tells us that decreases the chance of some young person developing an addiction problem, the fact of the matter is it does. And those are just healthy, wholesome family practices for raising kids, for parenting kids, that anybody can do. And you don't necessarily have to have identified that your youngster may be at risk for a substance use problem, or have identified that, hey, there are some warning signs of depression. The fact that you're doing those things will very often let you know that something may be wrong, that, hey, I'm not hearing good things from my youngster when we're having that conversation over dinner, or when they're talking to me about who their friends are and who they find interesting to hang out with and who they no longer want to associate with. And that alone can lead you to say, bring that up when you take your youngster for a checkup to the family doctor or the pediatrician. And that by itself is a very effective way to start that process for getting help for your young person.
Okay, so let's dive into maybe an example or something that we can use and share with people. So if, let's just say you are sitting down and having this conversation at the dinner table or on the couch or wherever it may be, teaching and letting young teens practice drug refusal strategies, because I think that a lot of times kids are they come up on these situations where it's sort of like the peer pressures. I mean, the peer pressures are at a piercing level these days, especially with social media and everything else and the challenges. So maybe what's a little bit of a dialogue, if you could give us an example of a dialogue you could have in a drug refusal strategy that could be used with a parent as they're having that conversation with their child, so that when they do come across that situation where they walk into a home and they say, here, grab a drink or take a hit of this or do that, how can a child be prepared to say no and to kind of do it, sort of without even hesitation?
Right. Some of it is just practice. And so one of the things that I recommend to a parent is, if they're at all comfortable trying to do this, is just role play it with your kid. You be that person at the party who's going to try to encourage your youngster to drink. and then let your youngster practice how they might say it. And parents, you know, we were, you know, adolescents don't realize this, but we were adolescents at one point. So we know a lot of the kinds of things that young people will say to make other young people feel bad and make them feel like they're not cool because they're not drinking. And you can practice those. And then when they stumble or they have a challenge or they have a difficult time, then you can provide them, okay, here, try saying this. Try saying, look, you know what? No thanks. I'm good. I don't want it. And then the person says, hey, look, you know, come on, man, you can just take a little bit. It's not going to kill you. Come on. They tell you all this stuff in school. It's not going to kill you. And then and then the parent can literally teach them, well, yeah, that's true. I know it's not going to kill me, but I also know I'm better off without it. So I'm good. I'm good. You know, that's one of the things. So role playing it. And when they stumble or when they struggle, the parent then help them with the words, help them with the language, help them with the strategies, and then role play it again and have them use it and do it, you know, because practice makes perfect, right? And so you want to have them practice role playing it out. Another strategy for parents, and I find that this has been helpful for a lot of parents, is also teaching young people this notion of being a leader. The fact of the matter is that some kids, more so than we might realize, have the ability to say, you know what, I'm going to define what's cool. I'm not going to let someone else define what's cool. I'm going to define what's cool. And so in my world, being cool is not drinking, staying in control of my mind and of my body, being able to be clear-minded so I can do my best academically and athletically. All right, so parents endeavoring to instill in their children the notion that they are valuable enough and their opinion and their sense of self is strong enough and is good enough that they can define what's cool, and let other people follow them into not drinking and not using because they've defined that as being cool. And I think there are far too few of us that have allowed people who want to use and get high and do all kinds of problematic things that have allowed them to own what's cool. No, you let your kid own what's cool. You let your kid be the one who defines what's cool, and instill in them the self-confidence and the belief and the confidence that says, you're my child. I love you. I know you're an awesome person. So you absolutely have the ability and the authority to define what's cool as much, if not more so, than anybody in your class. So you define what's cool, and you define that not using, not getting high, not drinking alcohol is a cool way to be. And I think far too few parents feel confident enough or feel that their kids are confident enough to hear that message and to embrace that message.
I absolutely love that. That is just such a powerful way to empower our children, our youth, to know that they can be the leaders. They can lead by example, and like you said, define what's cool, because I think that is lost on us a lot of times because we are going with what society thinks is cool, what social media thinks is cool. But why can't we generate that? Why can't we be the pioneers and the trailblazers of that definition of cool? So I love that. I think that's great. And that really just starts with empowering our kids to know that they get to, write their own story, and they get to dictate their own path. And, that path is going to look a whole lot better down the road if they say no and choose not to do drugs and or alcohol, and to pick up cigarettes and to pick up vaping and all the things that go along with, addiction and substance use and misuse. And so I think that's a great point you make. So we got about 10 more minutes left. Any more questions, please ask them. Another question that came down, and I think this is a really a great one. And I love how she voiced this. She said, people are a conduit of positivity. So how do you continue that positivity even in the darkest moments of denial? Because denial is such a big component of addiction and the disease of addiction. So how do you continue that positivity even in those darkest of moments?
Well, one of the things that we forget, many of us forget, is every day we wake up, that's a day we woke up. that in and of itself is a good thing. And that means that because of the fact that we woke up and we are alive, we have an opportunity to write our own story. We have an opportunity to make every day a good day. Okay.
Mm-hmm.
And so that to me is the ultimate basis for being positive. That I have a whole new opportunity to have a good day right in front of me. I can't do anything about yesterday, right? I have no idea what's going to happen tomorrow, but the one day I have control over is today. And I have an awesome opportunity every time I wake up in the morning to make today a good day, to make good decisions, to be good to people, to try and treat people the way I would want to be treated. I just have this opportunity. So to me, that's the basis for positivity. All right. When it comes to doing that in the context of denial, obviously denial, the whole purpose of denial is to protect yourself from something that seems like it might be painful. And the reality of it is one of the best ways that we can defend against denial is with the understanding that we have an opportunity to make this day a good day. So we don't have to shy away from those things that might be too scary. We can face them, because we can face them with the notion that we can deal with this as best we can, because we're working on making today a good day. And so that to me is the way that you address this whole notion of positivity, even in the face of denial. The idea is that denial puts up a barrier, and if you're living a positive life and you have a chance to make today a good day, you're going to knock down barriers, because you're all about trying to do the best with this day that you have, and barriers get in your way of that. And that's the way I understand that.
Yeah, the great John Wooden once said, make each day your masterpiece. And I think that is so critical in this time, is that we can make each day our masterpiece. And, whatever was on that slate or that canvas yesterday, maybe it's null and void. Let's forget about it, throw it in the trash. No big deal. Blank canvas. And, just kind of closing things out, we had a person jump on the Q&A thread asking about sharing your thoughts on COVID. And I know that you addressed that earlier. So this video will be posted later on, so you can go back and review some of those thoughts. Dr. Taylor touched on that, especially during this time. And so, as we kind of close things out, any final thoughts from you, especially as we talk about making each day our masterpiece? We are in the middle of this pandemic. It is devastating. It is impacting us in so many ways. There are challenges that are continuing to mount, and they are going to impact us for a very long time. Just any final thoughts and things that we can all be doing in terms of building resilience against some of these challenges and these things that could send us down that hole and down that pathway of addiction, or just, isolation, and how can we better be resilient and avoid, suffering in terms of our mental health?
One of the things that I have found many people will tell you over the years, people with addiction disorders, people with general mental health conditions, and people who have neither, who just are struggling to make it day to day. Very often it is very therapeutic to try to reach out to help somebody else. But one of the things that it does is it makes you feel good because you're helping somebody. It takes your mind off of your own problems, which is always therapeutic. And so helping somebody else can be very, very helpful. And a lot of times there are various ways that you can be of service to people and be helpful to people without necessarily having to, be out there on the streets or out there exposing yourself to COVID-19 or whatever. There are phone calls that people can make that can be beneficial to people. There are all kinds of things that people can do that may just contribute to society, that can help someone who is in need or who is in pain in some way. And I think looking for ways to help someone else can be a tremendously therapeutic thing for yourself. You end up helping someone else, but you end up helping yourself even more. And I think far too few people realize the therapeutic value of that. But I would say try to find some way to volunteer your time, to volunteer your gifts, your talents. Everybody has a talent. I was watching a show once when a young girl who was into sewing just started sewing masks. got into sewing these designer masks. And that was her way of coping with the fact that she couldn't really go out and she couldn't really do things with her friends, but she started getting into sewing masks and was developing these absolutely beautiful masks that were also being used to help people to protect themselves and protect others from transmission of COVID-19. And it was such a tremendous, it became such a tremendous thing that she ended up on the news with them covering this incredible effort that she was making. And all she did was took stock of something that she could do that she felt might be helpful to somebody. And all of a sudden she ended up being a celebrity on the news because of what she was doing was so beautiful and so special. That's just one example, but there are so many ways, you know, everybody has a talent. And I think part of the challenge is for people to think, what are my talents and how might I tap into those to help somebody else? Because if I do that, if nothing else, that's going to leave me less time to be focused on what's going wrong with me and what I'm sad about or upset about.
I love that. So everyone, you guys have some homework tonight. Go sit down, make a list of a few things that you can do to perhaps touch someone else's life, be an impact in someone else's life. And of course, hopefully you've taken some great notes. Maybe sit down and have that conversation with your kids. School's about to start back up. You know, now is as good of time as any to have those conversations. And even if you're not suspect that there's an issue, it's always good to have those conversations and build that trust and say, hey, you know, I'm not worried about you, but hey, let's go ahead and lay this roadmap out, right, for our kids and empower them to know I can define what is cool. And I love that. So I'm going to run with that one, Dr. Taylor. I just think that's tremendous. So as we wrap up, I just want to remind each and every one of you, first of all, I just want to say thank you, Dr. Taylor, for joining us. Such a tremendous, you know, honor to obviously get to speak with you, to pick your brain, to pull some knowledge from you. I always learn something from hearing you speak and hearing you share, you know, various bullet points about how we can be proactive and preventative as well. And I also want to thank all of our viewers for joining in. We really appreciate it. We hope that you will share this as we post it to the Addiction Prevention Coalition site, that you'll share this with your friends, your family, your loved ones, and those that can certainly benefit from this. And just a reminder, everyone, we would love for you to join us, like us on our Facebook page, stay connected. We've got the Addiction Prevention Coalition on Facebook as well as Instagram. So, you know, of course, follow us there. Make sure that you get the latest on all the news and happenings and everything that we're working on. Also, you can go to our website, apcbham.org. We'll have a link there, hopefully, in the caption or the description. There's a parent toolbox on the website that can equip parents to educate their children at every age. So we hope you'll utilize that toolbox along with, obviously, the things that Dr. Taylor has discussed with us today. And lastly, another project that we're excited to be working on, Prevention Partners. It's an opportunity for the Addiction Prevention Coalition to go out into the community, schools, community organizations, and the workplace to provide these opportunities and to partner with you to provide prevention resources. That is what we're here to do, to help you guys out. So please, if you have any request information, you can find that also on our website, apcbham.org. Again, thank you, Dr. Taylor. We appreciate your time. And we appreciate all of you out there. We hope that you all will stay safe and stay healthy.
Thank you.